We're often drawn to the headline-grabbing medical breakthroughs, big discoveries.
Hmm.
But the story behind how those treatments are actually delivered, well, that can be just as compelling.
Absolutely. Sometimes more so, the practical side of it.
Exactly. So today we're taking a deep dive into what might seem like a niche area, but it's fascinating. Hyperbaric medicine.
Right.
Think specialized chambers,
Yeah.
pure oxygen, higher pressure. Sounds a bit sci-fi, maybe.
A little bit, yeah. But it's very real. And within that world, there's this specific group of nurses playing a really pivotal role.
And the interesting part, which you hinted at, is how recent their journey to becoming specialists really is.
It really is. It highlights this whole evolution within healthcare itself. It hasn't been around forever, this specialty.
Okay, so that's our mission for this deep dive then. Let's unpack the vital and still kind of evolving role of nursing in hyperbaric medicine. We've got a great resource here, an excerpt focused specifically on the nursing side, the history, the growth, the practice.
Yeah, it gives a really focused perspective.
So get ready, because I think there are some genuinely surprising insights here about these professionals working on a pretty unique medical frontier.
It's kind of amazing when you think about it. A specialty you might not bump into every day, but it's got this rich, recent history, all driven by people who just saw a need.
They saw a need and built a whole profession around it.
Pretty much.
Okay, so let's start right at the beginning. You said recent. How recent?
Well, the emergence of hyperbaric nursing at its own defined thing. We're talking within the last, say, 47 years or so.
Wow. That feels incredibly fast when you compare it to, I don't know, surgery or other long-established fields. What does that time frame really tell us?
I think it really speaks to how quickly medicine can advance in certain pockets,
Yeah.
And then the need for specialized skills just pops up to support it.
Right.
If you look back at the very first nurses involved in hyperbaric settings, they weren't called hyperbaric nurses, not yet.
They were something else first.
Exactly. Like back in the late 1950s in the Netherlands, you had Dr. Ida Borema doing pioneering cardiovascular surgery in hyperbaric operating rooms.
Yep.
The nurses assisting, they were surgical nurses, highly skilled, but their specialty was surgery. They were just adapting to this weird, pressurized environment.
So bringing their existing skills into a new, challenging setting. Not really a new kind of nursing yet.
Precisely. And around the same time, another Dutch physician, Dr. Brummelkamp, was using hyperbaric oxygen therapy, HBO, for gas gangrene.
Nasty stuff.
Yeah. And the nurses caring for those patients in the surgical ICU during the HBO treatments, again, they were surgical ICU nurses doing their critical care job just during the therapy.
Their core identity was still surgical ICU or R nursing.
Exactly. Their contribution was vital, obviously, but the focus was on their established skill.
Okay, so when did that start to shift? When did someone say, hey, maybe there's something specific here for nursing?
That started kind of bubbling up in the mid-1960s. Early hyperbaric facilities were being set up in the U.S. and Canada, mostly for operating rooms still. And that's when you start seeing the first glimmers. Some nurses involved started thinking, maybe there's a distinct role here beyond just assisting.
The very beginning of the idea.
Yeah. And then, boom, 1969, that's the pivotal year.
Why 69?
Two key things. First, you get the first two nurses specifically trained in hyperbaric nursing. Tony Bishop, Royal Australian Navy, and Alice LaValle, U.S. Navy.
So they weren't just adapting skills anymore.
No, this was dedicated training, charting a new course. Bishop trained at the School of Underwater Medicine, which is interesting, right? Shows that early link to diving medicine.
Yeah, decompression sickness and all that.
Exactly. And Alice LaValle, she was huge. Developed a training curriculum over at Long Beach Naval Shipyard. You could almost call her like one of the architects of hyperbaric nursing knowledge.
Wow. So she wasn't just trained. She was building the training framework.
And then she went around sharing it, doing educational stuff. Really foundational work.
Okay, so two pioneers. What was the other big thing in 69?
Technology. The introduction of the acrylic-hulled monoplace hyperbaric chamber.
Monoplace. So single person.
Right. Before that, you often had multiplace chambers. Think like a small room, pressurized, holding several patients, maybe staff inside too. More complex.
I see, like a little submarine room.
Kind of. But the monoplace chamber was much simpler. Basically, a clear see-through tube or cylinder for one patient.
Okay. And why was that so significant for nursing?
Because suddenly, a single registered nurse could be trained to operate it and manage the patient's care right there during the whole treatment.
So it wasn't this big team effort needed just to run the chamber itself.
Exactly. It empowered the nurses, gave them more autonomy, and it was cheaper. Made HBO therapy more accessible, potentially reaching more patients.
That makes sense. Simpler tech, wider reach, bigger role for nurses.
You got it. And that leads right into 1970. Just a year later, Diane Norcool up in Seattle.
At Virginia Mason Medical Center, right?
Yeah.
Her work seems like another big step.
Absolutely. What Diane Norcool did was really recognize that HBO wasn't just for divers or surgical support.
She saw broader potential.
Yeah. She started developing nursing care protocols for patients with things like problem wounds, non-healing wounds.
Okay, that's a big expansion from just diving accidents.
Huge. It was a real turning point. It broadened the whole application of HBO, and that meant the nurses involved needed even more specialized knowledge.
And Norcool wasn't just doing protocols, was she? She did research, too.
That's right. She was building the evidence base early on. Her master's thesis was on HBO and burns in rats, but still, that's early nursing research driving the field.
Yeah, helping to put the science behind the practice.
You see this pattern, right? Individual nurses seeing a need, innovating, doing the research, building the foundation.
Okay, so the field is growing. The applications are expanding beyond just diving. It feels like the next step would have to be getting organized, right?
Exactly. The need for a more formal structure became really clear. And that leads us straight to 1985.
What happened then?
The formation of the Baramedical Nurses Association, the BNA, started by 35 registered nurses.
35 founding members. What was their main goal? Why form an association?
It was really about professionalization. They needed a platform, to set standards of practice for this specific type of nursing, to promote education, to support research.
I give it an identity.
Yes. Create that collective identity, build a unified body of knowledge, and do it internationally. That was part of the vision, too.
And guess who was the first president?
Let me guess.
Diane Norcool.
You got it. The same nurse who was pushing the boundaries of practice. That says a lot about her leadership.
It really does. And the BNA grew fast initially, which tells you there was this real hunger for it among nurses working in hyperbarics. And today, it's international. Still going strong.
What kind of nurses were drawn to this field back then? What were their backgrounds typically? It's interesting. A lot came from research backgrounds, critical care, emergency nursing.
Okay, high-pressure environments already.
Exactly. Fields where you need to be adaptable, super detail-oriented, good under pressure, literally, in this case.
Makes perfect sense. Those skills are totally transferable.
And that background influenced the early research focus within the BNA, too. Very practical stuff.
Like what?
Like, okay, can we safely use standard IV pumps inside the chamber? What about ventilators? How do we manage a medical emergency if it happens under pressure? Real nuts and bolts safety questions.
Critical stuff for patient safety.
Absolutely. And the BNA also started advocating, pushing for nursing's voice within the wider hyperbaric community.
How did they do that?
Well, they worked hard to get nursing presentations included in the big meetings of the Undersea and Hyperbaric Medical Society, the UHMS. That's the main group for the docs and researchers.
So getting nursing perspectives heard at the main scientific table.
Exactly. And you had key figures stepping up again. Diane Norcool, Valerie Messina, Diana DeShizis-Greenberg taking leadership roles, joining committees, developing educational programs that really highlighted what nurses brought to the table.
And then came a really big moment for recognition, right?
Yeah.
Getting into the textbooks.
Yes. 1995, a dedicated chapter on hyperbaric nursing appeared in Dr. Eric Kinwall's big textbook on hyperbaric medicine. That was huge.
Kinwall's book is like the Bible of the field, isn't it?
Pretty much, yeah. And that chapter, co-authored by Valerie Messina and Diane Norcool again, it really cemented hyperbaric nursing within the established knowledge base.
Gave it that academic legitimacy.
It provided this recognized foundation that others could build on. And this wasn't just happening in the U.S., remember? Nurses internationally, Canada, France, Japan, Australia, UK, India, they were all grappling with this too.
Figuring out how to manage their specific patient needs.
Right. Decompression sickness, sure, but also things like necrotizing fasciitis, pain control during treatment, helping patients deal with being in that confined space, that confinement anxiety.
Okay, so the field is growing, it's getting organized, it's showing up in textbooks. What's the next logical step for a maturing specialty? Proving competency.
Bingo. Defining competency. With the unique challenges of this environment, it became super important to clearly define what made a hyperbaric nurse competent, and that led directly to developing a certification exam.
Ah, the formal stamp of approval. Why was that certification so critical?
Well, several reasons. First, it really nailed down the specific knowledge and skills needed, what makes this different from, say, ICU nursing.
Right.
Second, it set a standard, a benchmark for safe, effective care, consistency. And third, it gave nurses that professional recognition, that validation for their specialized expertise.
And the BNA drove this process.
Absolutely. They were central. Defining the exam content, writing the questions, figuring out how to help nurses actually prepare for it. It was a massive amount of work.
Sounds like it.
And Diane Norcool, again, was right in the thick of it, working with Dick Clark from the National Board of Diving and Hyperbaric Technology. They had to make sure the exam met all the nursing regulatory criteria.
Like what kind of criteria?
Like ensuring a good chunk of it, they aimed for 40%, was specifically about nursing practice in the hyperbaric setting, not just the physics or the physiology.
Got it. Focusing on the nurse's unique role.
Exactly. So all that effort led to the BNA certification board being set up in 1995, and the first exam was given later that year.
And who took that first exam?
Get this, the first people to sit for the exam were the BNA board members themselves.
No way. They tested it on themselves?
Yep. Talk about commitment to the process, right? Setting the standard by meeting it first.
That really is dedication.
And that first certification, the CHRN Certified Hyperbaric Registered Nurse, wasn't the end. It evolved. Now there are advanced levels too, like ACHRN, CHRNC, recognizing more experience and expertise.
And how many certified nurses are there now?
The number's grown significantly. It's over 900 now, which clearly shows how the specialty's grown and how much value nurses place on getting that certification.
Okay, so we have the organization, the BNA. We have the certification, the CHRN. What was the sort of final piece needed to really say, okay, hyperbaric nursing is a fully defined specialty?
I think the final really crucial piece was having their own comprehensive textbook.
Not just a chapter in someone else's book.
Exactly. And that happened in 2002. The first textbook focused entirely on hyperbaric nursing, co-edited by Valerie Larson-Lohr and Helen Norvell.
That must have been a landmark moment.
Huge. It pulled together all that essential practical information that was scattered around before, all into one focused resource just for hyperbaric nurses. The definitive guide, like you said earlier.
Right. And they didn't stop there, did they? There was a second book.
Yep. In 2010, Hyperbaric Nursing and Wound Care. Larson-Lohr and Norvell again, with Josephson and Wilcox. This one broadened the scope, reflecting how important HBO had become for treating chronic wounds.
So keeping pace with how the clinical practice was evolving.
Exactly. And Dr. Robert Warner III wrote the foreword for that second book, and he basically said, you know, this shows how far hyperbaric nursing has come and how vital it is for the future. These books really mark the specialty coming of age.
All thanks to these dedicated nurses pushing it forward.
Tireless efforts, really.
Okay, so history, organization, certification, textbooks. Check, check, check. Let's get into the actual practice. The nursing process assessment, planning, intervention, evaluation. How does that work in this unique hyperbaric environment?
Well, that core nursing process, it's absolutely central. Still focused on holistic care, physical needs, psychosocial needs, setting goals, the whole thing.
But the environment adds wrinkles.
Big time. The hyperbaric chamber introduces this whole unique set of factors you have to consider at every single step of that process.
And the BNA actually published specific standards of care for this, didn't they? Like official guidelines.
They did, back in 1998. Comprehensive guidelines, care plans, desired outcomes, specific nursing interventions designed just for the challenges you face in hyperbarics. They've become the accepted standard.
Can you give some examples? What are these unique challenges or nursing considerations?
Sure. So when you're thinking about potential nursing diagnoses, you see things pop up like anxiety because the patient just doesn't understand the treatment. Makes sense, right?
Totally. That sounds intimidating.
Or the potential for barotrauma, that's injury from the pressure changes, usually ears or sinuses.
Okay.
Big one.
Got to manage that pressure equalization.
Yep. Then there's the risk of oxygen toxicity, because you're breathing pure oxygen under pressure. And of course, managing confinement anxiety, being stuck in that tube.
Wow, yeah. Those are all very specific to being inside that chamber under pressure.
Exactly. It just highlights the specialized knowledge nurses need, not just general nursing, but the physiology of pressure, high oxygen levels, and the psychological side of it all.
Which brings us to patient education. You mentioned anxiety due to lack of knowledge. How crucial is education here?
Oh, it's paramount. Absolutely crucial. When patients really understand what's happening, why it's happening, what to expect, they tend to stick with the treatment plan better.
Compliance improves.
Right. And their families are more supportive. It just leads to better outcomes overall. But there's a modern challenge.
Let me guess. Dr. Google.
You got it. Patients might come in having read all sorts of stuff online, some accurate, some not so much, misleading stuff.
Yeah, that's everywhere in healthcare now.
So the hyperbaric nurse has to be really skilled at navigating that, addressing the misconceptions, giving solid evidence-based info, but also being supportive, being truthful. It's a real balancing act.
Education mixed with empathy.
Exactly. And you use good adult learning principles. Figure out what the patient feels they need to learn. Start with what they know. Get them involved.
How do you get them involved?
Practical things. Give them a tour of the chamber beforehand. Let them talk to someone who's already doing the treatments. That can really help reduce the fear factor.
And to teaching practical skills, like clearing their ears.
Yep, that needs hands-on teaching, practice, reinforcement. The source material really stresses things like involving the family, using plain language, no jargon, and constantly checking they understand.
Not just asking, do you understand? Where they can just say yes.
Right. Open-ended questions. Tell me in your own words what's going to happen. Keep topics focused. Give them clear written stuff to take home. Reinforce it every time you see them. Use visuals.
All sounds like best practice for patient ed, but maybe amplified here because of the unusual nature of the treatment.
I think so. That active engagement you build through good education, it really pays off in better outcomes and patients feeling like partners in their own care.
Okay, care and education are huge. But what about research? We touched on Norcool's early work, but have nurses continued to contribute to the research side of hyperbaric medicine?
Oh, absolutely. There's a strong research ethic among many nurses in this field. They've made really significant contributions, sometimes leading their own studies, sometimes collaborating with physicians and others.
We mentioned Norcool, Larson-Lohr. Christy Pyrone was another name mentioned.
Yes, Christy Pyrone's work is a fantastic example of nursing-led research impact. She developed and launched HIMSS, the Hyperbaric Incident Monitoring Study, back in 1992.
HIMSS, what was that about? Sounds safety-focused.
Totally safety-focused. It's an anonymous, voluntary, international system for reporting any incidents or even near misses that could affect staff safety in a hyperbaric unit.
Anonymous and voluntary is key, right? So people feel safe reporting.
Crucial. The focus is 100% on prevention, learning from mistakes, not blaming anyone. It lets facilities everywhere learn from each other's experiences, refine their safety protocols.
That sounds incredibly valuable. Did it catch on?
Massively. It quickly got international buy-in, which just shows how needed it was and what a huge impact one nurse's vision for safety could have globally.
So putting it all together, it's clear hyperbaric nursing has come a long, long way in a pretty short time.
Remarkable strides. From just borrowing skills from other areas to being this well-defined, research-driven field with its own standards, certification, knowledge base. The whole package.
But still evolving.
Yeah, I'd say so. While it's definitely established, it still feels like a relatively young specialty in the grand scheme of things. There's still plenty of room for growth, especially around safety and refining patient care even further.
Okay, so to wrap up our deep dive here, we've really traced this fascinating journey from those early days in hyperbaric operating rooms,
where nurses were adapting surgical skills,
through the key technological shifts like the monoplace chamber, the founding of the BNA, the drive for certification in textbooks,
and the crucial contributions to patient education and safety research, like HIMSS.
It really paints a picture of a profession carving out its unique and vital space. These nurses play a truly essential role.
They really do. And, thinking about this whole evolution, how hyperbaric nursing grew, it really underlines how important specialization can be.
How dedicated professionals focusing on one area can really advance care.
Exactly. It makes you wonder, doesn't it? What other niche areas in healthcare might be on a similar path right now? Or where could a new nursing specialty emerge and make a huge difference for patients?
That's a great thought to leave folks with. Where else is this kind of focused expertise needed? A lot to think about.